All right, welcome back. This is presentation 4 of Chapter 14, Domestic Policy. And here we're going to move into the remaining dimensions of domestic policy, including public health and related matters. So, public health policies, no government, federal, state, or local, was directly concerned with individual health care, certainly not at the time of the founding, and really not until well into the 20th century. But public health has always been accepted as a shared and public responsibility. Following the success of New York City's Board of Health in holding down a cholera epidemic in 1867, most states created statewide public health agencies. Again, the problem was, going back into colonial times, that you had these airborne and waterborne diseases that were widely spread and devastating on communities. And so people recognized that you had to take collective efforts to manage these kinds of things. The U.S. Public Health Service was actually created in 1798. It was headed by a Surgeon General. Today it includes public health agencies like the National Institutes of Health, the NIH, and the Centers for Disease Control to confront public health threats. And today now it's the Department of Health and Human Services. Additional federal commitments to public health include laws aimed at environmental protection and consumer protection, the creation of the Environmental Protection Agency, and the Consumer Product Protection Commission are illustrations of these kinds of commitments. Health policies aimed directly at the poor include nutritional programs like SNAP, which we mentioned in the previous discussion, school lunch programs, and Medicaid. Healthcare reform. The United States is the only advanced industrial nation that doesn't have universal access to healthcare. Resulting from opposition of the American Medical Association, the New Deal omitted any commitment to universal health care in the New Deal. At the same time, I would note, part of the reason why why the AMA did, well, not about the AMA, but part of the reason why Democrats didn't do it was that a lot of Southern Democrats were profoundly opposed to giving health care to Black people. Again, the result has been a patchwork system that generally has less than universal access to health care, with rapidly rising costs of employer-based insurance programs that erodes the quality of care for a lot of Americans. And again, part of the problem is, again, if you have money, you can get the best care that human ingenuity can generate. We have the best quality of health care in the world for people who can afford it. The problem is, again, an access issue. The Affordable Care Act, otherwise known as Obamacare, following the 2008 election, Barack Obama prioritized working with democratically controlled Congress to implement comprehensive health care reform. Again, they had large majorities in the House and 60 votes, actually, a filibuster-proof majority in the Senate at the time. Ultimately, they spent 2 years fighting over it because there were some conservative Democrats who were worried about it. Ultimately, the Affordable Care Act, that's also the Patient Protection and Affordable Care Act of 2010, contained three key elements: creation of health insurance exchanges, the individual mandate, and subsidies for individuals and small businesses. 21 Republican-controlled states filed lawsuits against the Affordable Care Act, claiming that the Affordable Care Act's mandate was unconstitutional. The Supreme Court ultimately held the Affordable Care Act constitutional in 2012, and the GOP subsequently failed in its repeal and replace efforts in 2017. Access to health care remains a sharp point of partisan contention. Most Democrats believe that access to health care is a right. It's a human right. And Republicans view it more as something that is an individual responsibility. Insurance coverage, again, these are the number of people who are uninsured, and again, the the Affordable Care Act, clearly has reduced the number of unemployed Americans in the United States, but it hasn't ultimately eliminated the pool of uninsured folks. And again, the problem with uninsured, with lacking insurance, if you're healthy, it's not a problem. But if you get sick, if you have an injury that requires significant hospitalization or emergency care, then the bills could swamp you. And that's one of the main. That is a significant contributor to people declaring bankruptcy. Housing policies, access to quality, affordable housing provides individuals and families with stability and protection from pollution, disease, injury, anxiety, and depression. It's really hard to be able to go to sleep when you're not, you don't think you're safe. Most federal housing policies originated during the Great Depression, beginning with the Stegall National Housing Act of 1937. As a result of federal housing programs, the percentage of Americans living in overcrowded conditions, which was defined by the U.S. Census Bureau as more than one person per room, fell from 20% in 1940 to 9% by 1970. Over the same period, the proportion of American households living in substandard housing, which was defined again by the Census Bureau as lacking a complete kitchen or bathroom, declined from 50% to 8%. Despite those improvements, housing policy has largely been characterized as a failure for a variety of reasons. The primary criticisms include racial discrimination, inadequate maintenance of public housing facilities, and exacerbating the challenges of poverty by isolating the poor from shopping, jobs, adequate food. There's lots of food deserts in impoverished areas, and other kinds of urban amenities. The basic orientation of federal housing policies changed in the 1980s with a shift towards vouchers, which basically amounted to a credit that you gave to people that needed housing, and then put the onus on them to find a place where they could live. And again, a lot of times, apartments would refuse to accept those kinds of federal vouchers. Redlining represented basically a racist legacy of American housing policies. Redlining refers to banking and real estate agency policies of refusing to issue mortgage loans or extend credit in predominantly minority neighborhoods, and conversely, preventing blacks and other minorities from moving into predominantly white neighborhoods. Again, in 2007, 2008, you had that housing bubble that basically hit middle-class families harder than most others, and even beyond the end of the Great Recession in 2009, it had a profound, and lasting impact, especially on minority households. So who gets what from social policy? American social policies are a function of its politics and do little to change the fact that minorities and women are more likely than white men to be poor. Some benefit more than others, and among the groups that benefit more, the elderly, middle and upper classes, the working poor, the non-working poor, minorities, women, and children are, probably the least favorably affected. So if you look again at the elderly and the middle class, it's kind of a declining scale if you're looking at the slide. When you look at this slide in particular, you really get the sense of the impact of the regressivity of taxes on the state and local level. Again, high income folks pay about 9% of their income in taxes, whereas people at the bottom, 20%, they pay more in state and local government, largely because most state and local governments have some sort of sales tax as one of their sources of revenue, and that creates again a regressive tax environment. And again, you can see right about lower middle, the middle 20 to the upper, the federal and state, it begins to shift out. whereas these last two here, the bottom 20 and the second 20, in fact, at the lowest level, they're paying more in state and local government, state and local taxes, again, because they're paying in sales taxes for things that they have to buy. And then again, it gets leveled out when you get to that second 20th percentile. Who pays the most in taxes? Again, I think what you're looking at is it suggests again that lower, there is a certain amount of regressivity that is built into our tax structure. The wealthy have been successful effectively in shielding their income from taxation. And in fact, taxation falls a lot more heavily on middle-class folks, many of whom simply don't have the capacity to hide their money because most of their money comes in the form of salary. Their taxes are automatically withheld. So it doesn't put you in a position where you can go and hide your money somewhere in the Caymans or something like that. So domestic policy, what do you think? Economic and social policies raise issues that cut to the core of Americans' living lives and livelihoods. Government policies will affect your future job opportunities, what kinds of further educational or training opportunities you can access, and where you may ultimately live. Changing policies in any of these areas discussed involve making tough decisions. If you want more government funding for college financial aid, where does that money come from? If you want to focus more on job training or technical schools or community colleges, that money will largely come from higher education broadly. So how do you cut? Who's or to whom do you raise taxes on? So some questions. Most conservatives have pressed for freer markets and less government, while most liberals have defended the need for market regulation and more government intervention in the economy. Where do you stand? Do you tend to agree with liberals who often argue that more generous social policies are needed if the United States is truly to ensure equality of opportunity? Or do you tend to agree with conservatives who often argue that social policies that offer income support take the idea of equality too far and do for individuals what those individuals should be doing for themselves? What do you think is government's most effective tool in economic policy making? Fiscal policy, monetary policy, regulation? Which one? So look back at the story at the beginning of the chapter. What views do you imagine supporters and opponents of the child tax credit have about the role of the role of government? Do you think the coronavirus pandemic will change people's views about social and economic policy? Why or why not? What do you think the government should do to increase spending on, if any, social insurance, social assistance, tax expenditures? Who would benefit most from your plan? All right, that's it for this chapter. When we come back, we're going to move on to foreign policy. I'll see you next time.